Symptoms of an overactive thyroid. An overactive thyroid, hyperthyroidism, has many signs and symptoms, although it is unlikely you would develop all of them. Symptoms of hyperthyroidism. If you have hyperthyroidism, you may experience some of the following symptoms. Hyperactivity. Mood swings, such as anxiety, irritability, and nervousness. Difficulty sleeping, insomnia. Feeling tired all the time, fatigue. Muscle weakness. Needing to pass stools, feces, or urine more frequently. Excess fats in your stools, which can make them greasy and difficult to flush down the toilet, steatorrhea. Sensitivity to heat and excess sweating. Unexplained or unexpected weight loss, despite having an increased appetite, though in a small number of cases, the increase in appetite can lead to weight gain. Very infrequent or light periods, or periods stopping altogether. Infertility. Loss of interest in sex. If you have diabetes, your diabetic symptoms, such as extreme thirst and tiredness, may be made worse by hyperthyroidism. Signs of hyperthyroidism. If you have hyperthyroidism, you may have some of the following physical signs. A swelling in your neck, caused by an enlarged thyroid gland, goiter. Irregular and/or unusually fast heart rate, palpitations. Trembling or shaking, tremor. Warm, moist skin. Redness on the palms of your hands. Loosening of your nails and their nail beds. Hives, urticaria. Patchy hair loss, alopecia. Twitching in your face and limbs. When to seek medical advice. See your GP if you are experiencing any of the above. They may not be the result of an overactive thyroid gland, but they will need further investigation. It might be useful to make a list of your symptoms, as this can often be helpful in determining the correct diagnosis. Causes of an overactive thyroid. Overactive thyroid, hyperthyroidism, occurs when your thyroid gland produces too much of the thyroid hormones thyroxine or triiodothyronine. Overproduction of thyroid hormones can be caused by a number of conditions, which are outlined below. Graves' disease. Graves' disease is the most common cause of overactive thyroid. It can run in families and can occur at any age, although it is most common in women aged 20 to 40 years old. You are more likely to develop Graves' disease if you smoke. Graves' disease is an autoimmune condition. This means the immune system mistakes something in the body for a toxic substance and attacks it. In Graves' disease, it attacks the thyroid gland, which leads to an overproduction of the thyroid hormones. It is not known what triggers the immune system to do this. Like many autoimmune conditions, it is thought that a combination of both genetic and environmental factors could be involved. If you have Graves' disease, your eyes may also be affected, causing discomfort and double vision. This is known as Graves' ophthalmopathy. You may find your eyes bulge out or appear more prominent. For more information on Graves' ophthalmopathy, read our page on complications of an overactive thyroid gland. Thyroid nodules. It is possible for lumps to develop in your thyroid gland. These are known as nodules. It is not known why nodules develop, but they are usually non-cancerous, benign. However, the nodules can contain abnormal thyroid tissue, which affects the normal production of thyroxine or triiodothyronine, causing an overactive thyroid. Nodules that contain abnormal thyroid tissue are described as toxic. Toxic thyroid nodules account for about 1 in 20 cases of hyperthyroidism. Iodine supplements. Iodine contained in the food you eat is used by your thyroid gland to produce the thyroid hormones thyroxine and triiodothyronine. However, taking additional iodine in supplements can cause your thyroid gland to produce too much thyroxine or triiodothyronine. This is known as iodine-induced hyperthyroidism, sometimes referred to as Jod-Basedow phenomenon. It usually only occurs if you already have nodules in your thyroid gland. Amiodarone. Amiodarone is a type of medication known as an antiarrhythmic, which helps to control an irregular heartbeat, atrial fibrillation. If you have non-toxic nodules in your thyroid gland, taking amiodarone can cause hyperthyroidism because it contains iodine. Amiodarone can cause a type of hyperthyroidism usually more severe and difficult to treat through a harmful effect on thyroid tissue. This type of hyperthyroidism is called amiodarone-induced hyperthyroidism. Follicular thyroid cancer. In rare cases, you may develop an overactive thyroid as a result of thyroid cancer that starts in your thyroid follicles. This can occur if cancer cells in your thyroid gland begin to produce thyroxine or triiodothyronine. This is also known as functioning thyroid cancer. Treating an overactive thyroid. If you are diagnosed with an overactive thyroid gland, hyperthyroidism, your GP will refer you to a specialist in hormonal conditions, endocrinologist, to plan your treatment. The most widely used treatments for an overactive thyroid are outlined below. Thionamides. Thionamides, such as carbimazole and propylthiouracil, are a common treatment. They are a type of medication that stops your thyroid gland producing excess amounts of thyroxine or triiodothyronine. As thionamides affect the production of thyroid hormone rather than their current levels, you will need to take them for several weeks before you notice an improvement, usually between 4 to 8 weeks. Once the production of thyroid hormones is under control, your specialist may gradually reduce your medication. You may need to continue taking thionamides for a long time, until the condition is under control. Around 1 in 20 people will experience side effects when they first start taking thionamides, such as itchy skin rash, joint pain. These side effects should pass once your body is used to the effects of the medication. In rare cases, around 1 in 500, thionamides cause a sudden drop in white blood cells, agranulocytosis, which can make you extremely vulnerable to infection. Symptoms of agranulocytosis include fever, gum pain, swelling and bleeding, sore throat, mouth ulcers, persistent cough, shortness of breath. If you are taking thionamides and you experience any of the symptoms above, call your GP immediately for advice and an urgent blood test. If this is not possible, call NHS 111 service or your local out-of-hours service. Beta blockers. Beta blockers, such as propranolol or atenolol, can relieve some of the symptoms of an overactive thyroid, including tremor, shaking and trembling, rapid heartbeat and hyperactivity. Your specialist may prescribe you a beta blocker while the condition is being diagnosed, or until thionamide brings your thyroid gland under control. However, beta blockers are not suitable if you have asthma. Beta blockers can sometimes cause side effects, including feeling sick, feeling tired all the time, fatigue, cold hands and feet, trouble sleeping, sometimes with nightmares. Radioiodine treatment. Radioiodine treatment is a form of radiotherapy used to treat most types of overactive thyroid. Radioactive iodine shrinks your thyroid gland, reducing the amount of thyroid hormone it can produce. Radioiodine treatment is given either as a drink or a capsule to swallow. The dose of radioactivity in the radioiodine is very low and is not harmful. Radioiodine treatment is not suitable if you are pregnant or breastfeeding, and may not be suitable if you have eye problems, such as double vision or prominent, bulging eyes. Women should avoid getting pregnant for at least 6 months after having radioiodine treatment. Men should not father a child for at least 4 months after having radioiodine treatment. Most people only require a single dose of radioiodine treatment. If a further follow-up dose is required, it is usually given 6 to 12 months after the first dosage. A short course of thionamides treatment may be given a few weeks before radioiodine treatment, as this can lead to a more rapid relief of symptoms.